Hi guys, it's Julie from Pilates here. Welcome back to my YouTube channel. I'm here today with a very special guest and a slightly different video to what you're maybe used to seeing on this channel, and actually a slightly different video to what I'm used to doing. I'm here with my mum, who is going to share a really important story about just how healing Pilates can be. She's going to explain a little bit about the journey that she's been on with her health. Mum and I have worked very closely together for the last 4 years through some health challenges. Mum will talk a little bit about some of what those challenges are. And so we're both a little bit nervous. We've never done this before, but we think it's a really important story to share with people. Maybe you might be on a similar journey and you might hopefully get some kind of inspiration or some positivity from what we're going to share. So I've got some questions. We're going to do it in a little kind of interview format. So Mum, would you like to introduce yourself and maybe tell us a little bit about the journey that you've been on since kind of 2020, 2021? Because it's been a journey.
It has. My name's Wilma, and as Julie says, I'm her mum, and I'm really looking forward to sharing the journey that I've been on, and hopefully that I will inspire other people who are going to go through similar, because at some stage in our life we all go through some kind of trauma, one way or another. I will say that in 2021 I was diagnosed with bowel cancer and I underwent surgery. I have to say that I am all clear, and to be honest, completely honest with you, my Pilates classes have held me in such good stead that I would never have made the recovery I did if I hadn't been fit enough and strong enough with the Pilates.
Yeah, so Mum and I, like Mum said, worked really closely together to heal. In particular, she had quite aggressive surgery in her abdomen and was left with a colostomy. So we worked really closely together to restore that core function, so building that core strength back up and obviously bringing function back to her pelvic floor because she'd lost a lot of sensation in her pelvic floor due to the surgery. And just to give you a little bit of context, when we were working together, maybe a kind of year down the line, I had noticed that some of Mum's movements in her hips were actually quite restricted. And Mum had started to notice it herself. She was out cycling and feeling a little bit tight in her hips and a little bit like things weren't just releasing off in the normal way they would when we were doing our Pilates sessions. And as time progressed, I'd started to notice a loss of certain types of movement in Mum, which was in particular internal rotation over a hip and what we call inner range hip flexion. So that's where you kind of are able to flex your knee all the way in, and a little bit of hip adduction as well, where the leg crosses the body. So there was enough, kind of signs there, and Mum also developed a sort of gripping sensation. Mum, I don't know if you want to describe that kind of sort of
terrible
in the
pain
front of your hip that you got. Yeah.
In the groin. It was mostly in my groin on both legs. I have to say that it developed in one leg and then soon after it developed in the other leg. And if it hadn't been for the fact that I did Pilates, I doubt very much if it would have been noticed as quick.
Yeah.
And
is that because you had that awareness of, through doing all those years of Pilates, you really build that awareness of how your body moves.
Very much so, very much so.
Yeah.
And you were quick enough to, doing classes, you recognised it very quickly.
Yeah.
And that, of course, prompted us to go to a GP, to start an investigation.
Yeah.
And I did have x-rays which showed that I had developed osteoarthritis, or wear and tear as they say.
Yeah.
But you have to take into consideration my age. I was 73, 74. So I suppose, something starts to go wrong when you do get over 70, things start to deteriorate just that wee bit.
So that's right. So we went for the x-rays and it was confirmed Mum had osteoarthritis in both hips and went on a wait list for total hip replacement. We are now sort of 13 or 14 weeks past first total hip replacement in her left hip, and depending on when you're watching this video, this is the end of August 2024, Mum goes for her second total hip replacement in her right hip in just a few days' time. So before we get to that, if we can kind of just circle back a little bit to the first hip replacement, which is what we're here to talk about. Could you tell us like kind of how you felt leading up to that first surgery, given that you've already had quite a lot of surgeries, people poking around your Mum, which I'm sure you were really fed up of, but just talk us through how you were feeling leading up to the first surgery. What were your sort of biggest fears or concerns?
I don't think I had any fears. My only concern was that, like any surgery, it has its own risks. But I do know that hip replacements are one of the most successful procedures in the world. Yeah. And that in itself gave me a lot of confidence. It was substituted by the pain. The pain in both my legs were excruciating, and made my mobility and my ableness to do things that I normally did, were totally unable to do them. Yeah. Which you really take ill out, and I began to think, please, if I don't get this done, I'm going to lose all my mobility, and will it ever come back again? I then had to not do as much Pilates because I couldn't do what I would normally have done in a session. And at the end, really, I was doing no Pilates. I did try to walk every day, but I was walking with 2 sticks, and I couldn't walk very far. And to be honest with you, it was grit your teeth and get on with it, really. To be perfectly truthful, it was dreadful. So that made me more positive to think that if I get this hip operation and it's successful, that I would be pain-free. And that was incredibly important. Yeah. I am independent, I live alone, and you really take it ill out when you are dependent on other people doing things for you, doing housework, doing shopping. I do other social things, and I just had to give them all up. So that was a really hard and difficult situation to accept, to be honest.
Yeah. So a lot of changes to Mum's normal kind of daily routine, if you like, all the kind of things that she loved to do, as she's mentioned there, she had to do less and less of because the pain was so much in her hips that it was almost impossible to do all the things that she loved. But she's mentioned there she did keep a couple of things going, which probably one of the most important things was walking. So the worst thing you can do in a situation where you are waiting on something like a hip surgery or any form of surgery is not do any movement. You are far more likely to recover quicker if you keep some form of gentle, very passive mobility. So we worked, as much as we could to prehab Mum's body. So it really was just gentle walks. Yeah. It was a little bit of sitting and then a little bit of just lifting the leg, keeping that sense of mobility. Some things that Mum could do. So we tried to focus really on, let's not think about what you can't do, let's think about what you can do. Mm-hmm. Sitting, doing some kind of ankle circles to keep the ankles going, a little calf pump, so lifting and lowering, because that's incredibly important pre-op and post-op to keep the blood circulating. She was still able, obviously, to do full mobility in the upper body. So Mum has little hand weights, so we were doing little arm circuits just to keep the shoulders and the arms healthy, and lots of nice rotation to keep the spine healthy as well, because when you start to move less, everything kind of stiffens up. So although it's not Pilates in its maybe truest sense on the mat, etc., it just, I think the both of us, I probably totally underestimated just how many things you can do with Pilates that don't actually involve lying down on a mat. So I think that was really important to strengthen the body.
Absolutely.
And I think, Mum, as well, it kept your mind occupied. So,
Good.
you know, for me as looking after Mum, you know, you start to get really concerned about somebody's, you know, mindset. And in actual fact, I would say 90% of it becomes a little bit a battle of your mind. But I don't know, like when we were doing our exercises, it seemed to give you a focus and a sort of allows you to just come out of your sense of worry, Mum, and just focus on being a bit more present on what you were doing.
It took away the self-centeredness that you get for yourself, thinking, oh, woe am I, because, you know, why is this happening to me, why can't I do stuff? But when you make the effort and did the exercise, you did get a much better good feel factor in yourself.
Which is so important, isn't it?
Oh, it's incredibly
to keep
important,
that mind
because you
sharp.
then you feel so isolated when you are normally
so active,
proactive and out and about and doing everything.
Yeah.
It's so destroying, to be honest with you.
But you've come through it, so we've had a very successful first total hip replacement. So in the UK, the sort of favoured way to operate on the hip is usually through the back of the hip. So the technical term is posterior hip replacement, which is where they cut the glutes and a muscle called the piriformis, which is one of the external rotators of the hip. And Mum was up and walking the same day as she had the surgery. Do you want to tell us a little bit about why you think you were able to get up and walk unaided? So nobody came to help her get out of bed. Mum was able to get up and out of bed herself on the day that she had her first hip operated on. So do you want to talk to us, Mum, maybe a little bit about how you then went into recovery? So just a little bit kind of that healing journey.
Yeah. I think, you know, through Julie and the Pilates and the determination that I needed to get my life back, to be honest with you, that was all part of getting myself mobile again. And of course, in the hospital, they do get you up. And I just thought, you know, I can do this without a problem. I'm fit enough. I've worked hard beforehand with all the pain to be able to be mobile. And I did. I'm not saying it wasn't painful, but it was completely different. It was wound pain rather than the hip pain. The hip pain had completely gone.
And
The disadvantage was it was only the one hip, and I still had the pain in the other hip. But it was like night and day, and I felt, you know, I can manage this now. And it was a blessing, to be honest with you, to be able to get up, put my foot on the floor, to be able to walk, and then rest on a chair. All on the same day. It was quite unbelievable. Quite unbelievable, really.
And remember, Mum still has the arthritis, and still does now, in the right hip. So she was in this kind of 50-50 situation, which can be, you know, like Mum says, is a blessing, but also incredibly frustrating at the same time, because she had this, all of a sudden, this new sort of fixed hip, if you like, this sense of freedom. But actually, what became just as important was making sure that the right hip, the one that's still to be operated on, didn't hold her back. So a little bit of managing fear as well. Do you want to talk, Mum, about, you know, just some of the exercises? So just to give you a little bit of context, you know, maybe we will do a little Pilates video on this in the near future if you think that would be helpful. Mum's rehab, I did some training in how to approach Pilates for recovering or supporting recovery of total hip replacement through my educator, who is Body Control Pilates, based out of London. And we approach Mum's rehab from 0 to 6 weeks, so the first 6 weeks post-surgery, which are the most critical. And just to give you a bit of context, a lot of that is just restoring mobility, and it's very, very gentle movements. There are some movements that are completely what we would call contraindicated. That just means you have to avoid. So that's adduction of the hip, where the leg crosses the hip joint, internal rotation of the hip, and also flexion past 90 degrees. So we had to work around all of those movements. We couldn't do any of them, but our main focus was on restoring glute function, because those were the muscles that were cut through during the surgery. So we focus on 0 to 6 weeks, 6 to 12 weeks, and then 12 weeks plus, which is 3 months post-op, where we are now starting to bring back some of those moves. Like mum can now flex her hip to 90 degrees, and we're just focusing on a little bit of squatting, but mum might be able to just explain some of the exercises that you find maybe particularly helpful from a Pilates context. Things like your sort of Pilates bridge, your squats.
Yeah.
Do you want to talk a little bit actually about how some of the things you noticed were quite difficult for you to do, like getting out of the chair?
Yeah. Obviously, initially, it is incredibly important to do the exercises at least once a day and try to walk. Julie did at the beginning. She would come down in the morning, and we had a sheet, a slide sheet that we could put on the bed, and we did the exercises on the bed.
Yep.
And the slip sheet really did help with the different movements. For instance, you have to learn to slide your leg along.
Good.
And that was everything was incredibly painful. But every day there was an improvement, and the pain got less, and your confidence, or my confidence, grew, because I thought, oh, I've done it, I can do it, oh gosh, and I maybe was a wee bit anxious to do more, but the boss, no, you don't do that, okay.
So I think Mum's just saying there, it's good to have, I guess, somebody to and Mum is incredibly lucky from that respect, somebody to kind of just help and watch you. And sometimes I think a lot of it is just giving you that support. When you're in the thick of it, again, your mind becomes the biggest battle, and it is a slow and long recovery, a rehab recovery. You know, Mum would sometimes get frustrated that she wasn't getting
on fast enough,
on like quicker or fast enough. But a rehab journey, I think a lot of people think, and I was explaining this to Mum, you know, after a surgery, a lot of people think that rehab goes all the way up and you just get better and better and better, and actually it doesn't follow that pattern at all. I've worked with so many people that have been in rehab situations and get referrals from physio, and a lot of the rehab journey is more like that. You go up and down, sometimes you regress before you can go forward, and it is incredibly frustrating, and you have to be really kind of strong in your mind to, you know, to know, to stay positive and know that it will get better. And
that's right. That's incredibly important. The milestone was definitely the 6 weeks. I have to say that, you know, aftercare from the NHS was non-existent, to be honest. And I feel that if there's a message to go to women, or men, anybody that's going to undergo the hip replacement, that they look at Ostara Pilates and stick in and do it, because it really, really works. Once I had done the 6 weeks, and Julie wrote a new programme out for me, 6 to 12 weeks, and again, once you start, I was able to get down on the mat, but the boss, as I call her, she showed me how to get down and how to get up without losing the 90-degree rule, crossing the legs over, which I can do now without that, but that's now, I've done the 12-week regime, which I'm continuing to do, but we're adding on, and it has been quite remarkable how much that 1 to 6 weeks, the 6 to 12 weeks, how much progress has been made. This right hip has hindered, because I'm absolutely 100% certain that I would have been much further ahead had I not had the drawback of this new hip.
Yeah, so it's been quite interesting to watch Mum, and again, it's not, I don't think it's a typical story. Obviously Mum's had one hip's better, we've been able to really work on that and get the mobility and the movement back in it, but also frustrating because she is held back somewhat by the other hip because it's not able. So we noticed when we went into 4-point kneeling, obviously when you do something like a leg slide in 4-point kneeling, which is where you slide your leg away, and then we were, again, because we're focusing on the glutes, lifting that leg into extension to work the glutes, you are asking the other side of your body to stabilise you, and that became a little bit challenging for Mum because she didn't, she's that joint is kind of done, and it's not got the strength there that she probably needs to allow her to do that move smoothly. So we had to
oyster.
Same with oyster, so we were able to do a few rounds of oyster, but again that involves lying on Mum's non-operated side, which just became too painful, so we both accepted that actually this isn't going to be the right exercise for you for now, Mum. We can park it, but it will be coming back, so don't worry, the oyster's coming back. We just have to get the other hip done, and that's kind of how we approached it. There is no, again, two rehab journeys the same. And again, the benefit of, just from my perspective, being there for Mum is that we were able to have that conversation and say, right, I think we just need to not do this exercise for now because it's not helping you actually. And actually, we can just focus on doing more bridges. So again, a lot of functional movements for the glutes. So we're doing a lot of squats. We'll come on to talk about squats in a minute. Bridges, lying on your front in prone, what we call, so face down on the mat and doing single leg extensions.
Prep for swan.
And prep for swan, yeah, to really work the glutes, so you work the glutes.
Working the glutes, yes, absolutely. If there's anything if there's any proof of the pudding required, I attended last Monday a pre-op.
Oh yeah, so we were at the pre-op, that's a good point actually.
Yes, assessment.
You go for the pre-op assessment before your surgery, you consent to have the op.
And the surgeons and the senior staff were absolutely amazed at my mobility and my walking and what I was achieving, and their words were perfect patient, which I'm not, but they said perfect patient, and the other words they used were very, very seldom do we have somebody coming in to have another hip operation after 3 months.
Yeah.
So that speaks volumes, really.
Yeah, and it is true. They were all so impressed with, I think some of them were just like, oh, you're back already. We never normally see somebody back this quickly. So it just goes to show if you put the work in, and it is true, persevere, even through the most, challenging, because Mum is already compromised in her core as well, remember, because she still has a stoma. So this is why we wanted to tell this story, because it's multi-pronged, and Mum has come back from setback after setback after setback, and you can too. I think that's the really important message that we wanted to share, is that you can too if you just
keep focused,
stay consistent. Tiny little things, just tiny little things every day. It doesn't have to be big.
As you said, Mum, little and often wins the race.
Yeah.
And that is really true.
Yeah.
And the feeling that you get within yourself is unbelievable. I know that this time next week I'll be home, hopefully, and started the recovery. And I'm doing it with such a happy heart to know that I'll have no pain.
I know. I know, it's been a wee journey. You've been just incredible, Mum, and obviously I would say that it's my mum, but she honestly, really has. In many ways I wish I'd started to film a lot of what we've gone through 4 years ago, because I genuinely don't think anybody would believe it. But the body's ability to heal itself as well is incredible, and actually what we've not talked about is a lot of breathing exercises that we've done, because that's a really important way to manage anxiety. If you are worried and an anxious person, and I've been sitting in hospital waiting rooms, kind of talking my own self through the importance of staying mindful and using my breath to kind of calm and regulate my nervous system. So there are so many important parts to a movement practice, or just looking after yourself.
There are so many facets to Pilates. There's something in it for everybody, without a doubt.
It really is.
And I haven't got a negative thing to say about Pilates. It's all positive, And obviously I've done Pilates for a number of years because of Julie, and her encouragement for me to stay as fit as you possibly can, to maintain your independence, which I think is incredibly important.
Yeah. And can you just talk about, so there was a really interesting, at one point we're talking about mindset shifts, and at one point, I'd come to Mum and she was struggling to get out of her chair. This was after the operation, and I think Mum thought she was just going to be able to sit in her chair, pop up, and that'd be it, as in pop up normally. And she was having to use her sticks, and she just felt like she couldn't get up out of her seat. And I said, Mum, that will all come back. The glutes are the main driver. That's hip extension. You're going from a seated position to a standing position, and it's your glutes that get you there. So, you just need to be a little bit mindful. We'll work on our little Pilates squats. We'll start small, and before you know it, you'll be able to squat down to the chair and get back up. And that's what we were doing. We built in little, mini squats. I mean, you probably would look at somebody and think, that's not a squat. But it was a squat, and Mum was using the sticks. And it was a start. And so tell us, Mum, any issue getting up and down out of a chair now? Apart from obviously she still has that dodgy hip.
Again, I have to say that this hip does hold me back. I can't emphasise that enough. But on the positive side, by doing the chair, at first I was having to hold on to the sides to get myself up and down.
You couldn't even do that.
No, I couldn't do that.
12 weeks ago, you couldn't get out of the chair, which is, this just shows
now
you it's amazing.
I can rise and sit down without holding on.
Yeah.
I would
You went from 2 sticks down to 1 stick.
I went down to 1 stick, and I don't
just progressive.
Yeah.
That's all we've done is worked progressively.
That still is quite a difficult one for me to do. Is I have to stand up every day 10 times without holding on, which I am doing, but I know that when I stand up after this one, I'll be through the roof.
You'll be skipping soon.
I'll be skipping.
Back to running. The goal was to get her back to cycling. Mum likes to cycle.
I like to cycle in between doing my Pilates.
You do, yeah. And what advice, Mum, would you give to somebody that's maybe about to go through total hip replacement, or even any form of surgery, or
Is to have a lot of faith and believe that it's going to work. Sometimes when you're signing all the forms, you're signing your life away.
Feels like that.
It feels like that, but to be...
It's just paperwork.
A lot of paperwork, that's right. If it needs to be done, you have to have a positive outlook to the future. This is going to benefit me and everybody around me because I'm going to be well again. And I think that's incredibly important for your own well-being, to believe and know and keep your faith that you're going to get up and down and do whatever you normally did after it, regardless of the recovery period. You have to be patient with yourself, which I've learned because I'm not the patient person.
I have to be patient too.
Tell you to be patient.
Very patient.
And not to be afraid you're in good hands.
Yeah.
Yes.
And it is, as a teacher and a daughter, I've never had to work so closely with any patient in my life. It has been at some times for me, maybe I'll do a separate video on that, quite, I don't want to say the word taxing, because it's the greatest privilege is to be able to work with my mum and help with my mum. But from a mindset point of view, it can be quite low as well. But that is just life sometimes, and you have to take moments to restore and your own self and look after your own self if you're caring for somebody, if you have the responsibility for somebody in your life that you're looking after. It's not just about that other person. Remember, it's also about you and looking after your own well-being as well. So if you're watching and you're one of those people like me that has to do that, then look after yourself as well. And I think that's kind of everything that we wanted to cover. So Mum's got her second hip surgery, so maybe we'll do a little follow-up video if you enjoyed this. Because we've been a little bit nervous doing this because we've never done it before. So just, hope you've enjoyed it. Hope maybe you found something useful in it.
My big concern is anybody who has, I can only talk about hip, I can talk about having a colostomy and then having to have the hips done. And I have to say that Pilates has been my godsend. Without a doubt, that my level of fitness for my age, maybe not just at the moment, but prior to all of that, has held me in such good stead.
Yeah.
Absolutely.
That's a really positive message, and
Yeah.
to end it on. And
So-
how many surgeries have you had, Mum, in the last 4 years?
Oh.
Do you know? 6? 5 or 6?
Six.
6 surgeries Mum's had. Serious surgeries in the last
All major.
3 or 4 years.
Unfortunately.
Yeah, major surgery. So, and she's 75?
75, but I'm going to repeat this year, so next year I'll be 75 too. I'm taking this year back.
Let's all do that. Let's all repeat
Yeah,
your...
I'm taking my year back.
Good, okay. Fab. I think that's it. Well, thanks for joining us. Don't forget to subscribe to the channel, and yeah, maybe do a little follow-up once hip 2's done, and actually maybe we'll do a little mat session as well, so you can follow along if you're in a similar situation. Thanks for joining us.
How well you can do.
She's showing
Because
off
I
now.
can't do this one at all.
She's showing off now.
Yeah, I can lift this leg up and down.
We'll see you back on your mat soon. Bye.
Fine.